Hello, everyone. I am sorry I'm just a couple minutes late today. I'm here at the dental office and, it's kind of fun. We have an entire videography studio. In fact, since I'm here, I might as well show you what we do here. This is Aubrey. He's our videographer, and he and I were just doing some really cool videoing. I don't think I'm showing you what I'm supposed to be showing you here at all. He and I were just doing some really cool videoing with a whole bunch of drinks and testing the pH of all of them and seeing how that influences cavity development and all kinds of cool stuff. So anyway, that was fun to do that today. And we found some really interesting things. So we tested kombucha, Gatorade, tea, coffee, a whole bunch of sodas, some energy drinks. And what we found was that, and we even tested water, tested smart water. We tested Kirkland water because these are the waters that a lot of us drink. And what we found is that kombucha is as acidic as energy drinks. Isn't that crazy? Coffee and tea are a little bit better. Soda's right down there with them, very, very acidic. And what does that acidity do? Well, the acidity actually just dissolves minerals in the teeth. It pulls minerals out, leaving a hole. Bacteria crawl in, and that's where you get cavities. So we're going to do a whole big long video about this, but I'll give you the sneak peek version. Basically, what we learned and what I already know is that the frequency of putting acid on your teeth is the dangerous part. So some people will say, well, I just drink 1 can of Coke a day. I just love my 1 can of Diet Coke, but I nurse it all day long. That's actually worse than just downing that 1 can of Diet Coke. Why? Well, because what happens in your mouth is when you drink something acidic, it lowers the pH. And when a pH is lower, it becomes more acidic. When the pH is lower, it dissolves the minerals in the teeth. If the minerals are dissolved, there's a hole for bacteria to crawl in. Bacteria crawl in, they eat sugar, they excrete or poop more acid, and the hole gets bigger. And that's how a cavity progresses. So if you are constantly drinking something that's acidic or eating something, even eating anything, what's happening is your mouth pH has to drop a little lower every time you put it in your mouth. And it never gives the mouth time to get back to neutral pH. We want it to be about 7. It never gives it time to neutralize again. So if you're constantly just sipping something, it's very dangerous for your teeth. Your saliva never has a chance to neutralize it and balance it so that it's not going to be pulling minerals anymore. So if you're going to drink something that's acidic, kombucha, anything that's on our list, if you're going to drink it and be done with it. Don't keep continuing to drink it. Otherwise, you're going to be at risk for more tooth decay. So anyway, that was an interesting video we were filming this morning. All right, let's jump on and do some questions here. Is the charcoal in your tooth powder made from coconuts? I actually don't know the answer to that, so I will find the answer on that one. There's a lot of debate about charcoal and whether that is dangerous for the teeth, whether, a lot of people will say things like, this is going to scratch your enamel. Well, this actually isn't going to scratch your enamel for simply a scientific reason. There's something called the Mohs hardness number. And what the Mohs hardness number is it's just detecting the hardness of a substance. So a lot of people know diamond and glass, right? I actually have glass sitting right here. So we know that diamond will scratch glass. Why? Because diamond is harder than glass. So anything that is harder, so they do it on this Mohs hardness scale, anything that is harder will actually scratch a softer surface. Well, I know the Mohs hardness number is on everything that I have in all of the tooth powders. And dentin and enamels, the two surfaces of the tooth that you're going to be brushing against, have a Mohs hardness of anywhere from 3 to 5. Charcoal has a Mohs hardness of 2. So remember, we said the harder the thing will scratch a softer thing. Charcoal is softer than tooth structure, so it will not scratch tooth structure. So people often debate, it's interesting. It's kind of one of those things that everybody says, oh, charcoal's it's going to scratch your enamel. And then everybody just takes that at face value. Oh, it's just going to scratch your enamel. And then everybody just keeps parroting the same thing. Oh, it's going to scratch your enamel without any of them actually understanding anything about enamel, about charcoal, about how hard they are. So I like to go back to the science. Let's look at the science of it. Let's see if that makes sense. If it makes sense, great. It makes sense. If not, let's talk about that. So that's the truth about charcoal. I have Sjogren's. Would the powder be good for me to use or not? Excellent. In fact, that's one of the things that I talked about on this video, talking about acidity in the mouth, is that when you have a dry mouth, and one of the symptoms of Sjogren's is very dry mouth. When you have a dry mouth, you don't have enough saliva to clear the plaque off the teeth. Well, that's dangerous because if the plaque sits, it's very acidic inside of that plaque and it dissolves the minerals underneath it. So you are going to have to be very meticulous on your cleaning, but you need to add hydroxyapatite, so the tooth powder and particularly the mouthwash. because you need to get it into all the nooks and crannies that you can't even get to with a toothbrush. So Sjogren's with any kind of dry mouth, which could be from high blood pressure medication, whole bunch of different things, sometimes even just aging. If you have a dry mouth, you absolutely need to be using the hydroxyapatite products. They are going to save your teeth, as well as vitamin D3 and K2. I was looking at your baking soda test for low stomach acid. I've suffered from acid reflux issues for years, but I'm also now pregnant. Can I do this test while pregnant? Absolutely, you can do the test while pregnant. The cool part about it is it's just baking soda and water. So it's no difference than taking a Tums. That's all that Tums is basically just an alkaline component that you're eating to help to neutralize the acid. So that's all you're doing, is you're just putting a little bit of alkaline material, which the baking soda is alkaline, in to mix with your stomach acid. And we want to see the reaction. That's the key, is what did it do? How did it react? If it reacted, if you got a burp, it means you've got enough acid. If you were quick on the burp, it means you may have too much. If you were slow on the burp, it means you have too little, which usually is the key. Sometimes people say, oh, I have stomach acid. I have too much acid, acid reflux. I guarantee I have too much acid. And they take the test and they find out they have too little acid. And that's really what's causing the reflux symptoms. So yes, very much you can do it in pregnancy. My son's other milk tooth incisor isn't out yet, and yet the other one has been out for about 3 years. Could there be a problem? He is 8. So there could be a problem with that. So basically what you're saying is that, you know, the front teeth here, one has been out for a long time. The other one hasn't come out at all. A lot of times it's because there's not enough room in the mouth for the tooth to come in the proper position. So a couple of things. First of all, look and see with your son if he mouth breathes. Does he mouth breathe at night? Does he, is he a loud breather? Can you hear him breathing through his nose, or is he actually breathing through the mouth? Does he have bedwetting issues, ADHD, focus issues, any of those things? Those are all signs that he's not getting enough air and the mouth isn't big enough. At that point, we say, come on in, let's talk about some expansion things we can do, or check out toothpillow.com. Again, some expansion options on there to make more room, so there's room for the tooth to come in. That's option number one. The second option is sometimes it's just been stuck up there so long that the gum, so if the baby tooth has come out, but the permanent tooth hasn't come in, and I don't know the situation here. It may be that there's still actually no, it says the baby tooth's still in. So that is, I think, probably the issue, is there's not enough room for that tooth to come where it's supposed to come, so it just stays up high. So you need to make more room in the mouth, and then the teeth will come in as they're supposed to. What crock pot do I recommend? Aren't enamel and nonstick such as Teflon toxic? I don't do any nonstick Teflon. I do stoneware. So enameled stoneware doesn't have the same issue. So nothing Teflon, nothing that you're going to be able to scratch off. That's the key, is that scratching off that Teflon gets into, they call it a forever chemical, gets into your system, never leaves. Teflon, no go, but stoneware is good. It's a good thing to cook with. I've been in myofunctional therapy for almost a year now. I had my tongue tie addressed. Now I'm shopping for a dentist to fix my bite that was thrown off by an implant and then crown. I'm just wondering if best practice is to establish the bite or clear decay first. I've gotten 50-50 split of opinions. Okay, so the question is, you're in the middle of treatment. You're wanting to get bite fixed, but it sounds like you have tooth decay. Tooth decay is absolutely first. Why? Because tooth decay is progressive, meaning the longer it goes, the more expensive it's going to become, the more risky it's going to become for the tooth and actually leading to tooth death in the future. You want to address decay first, absolutely 100%, because the bite isn't progressive, right? If you fix it today, if you fix it in 6 months, the bite problem is still there. Get the decay fixed first. The bite problem will still be there when you get the decay out. But you don't want the decay there when you're fixing the bite, because the decay is progressive. So cavities first, then fix the bite. Can I ask what crowns you use? I did the Biocomp Dental Sensitivity Lab, and I have sensitivities to lithium and zinc. What cement would you suggest? Does zirconia have lithium? Good question. So no, the crowns that we do use something called lithium disilicate, which is a common kind of crown, which you're not going to want. So a common name for it would be Emax. You're not going to want that kind of crown. You're going to want a zirconia crown. It does not have lithium. Zirconia is basically a pure element. So it's one material. It does have some other things mixed in with it, but it's pretty much a pure material. So zirconia is what you're going to want. The Biocomp sensitivity test should have told you information about cements. So make sure you look on there and choose one. It will not have modern day cements don't have zinc in them. And typically the ceramics have lithium, but not the cement. So you're going to probably use a resin cement for that. But again, your Biocomp lab will give you recommendations for that. How can you reduce stains on teeth? All right, so a couple things about reducing stains on teeth. Number one, you need to reduce why they're getting there. And then number two, you need to get them off. So reducing why they're getting there. Sometimes this is just simply the food you're eating. If you're eating a lot of highly pigmented foods, so coffees, teas, things like blueberries, things that have a lot of color to them, you may get more staining. But another one that you might not understand is that it often is something called chromogenic bacteria, meaning the bacteria that in your mouth actually create colored plaque. Interesting, isn't it? And it is based on the bacteria. So if you're getting a lot of staining that's just this chromogenic bacteria, it'll often be orange, yellow, sometimes green, oftentimes black. That is more a bacterial issue. So oil pulling, but also an oral probiotic may be a great way to start. I have a new toothpaste coming up. It's going to have what's called an optibiotic that's going to take care of all of this, but it's not out yet. So an oral probiotic for the moment and some oil pulling will help that. If it's that bacteria, like if your plaque itself just is discolored, then that's a bacterial issue. How do you get it off? Well, the remineralizing and the whitening tooth powders are fabulous for that because they do stain is softer than enamel. So it will remove stain. They will remove stains. So use either remineralizing or whitening tooth powder and you're going to be able to get that off. What can I do for gum recession without surgery? So the key is there tight gum tissue? When you look at your own gums, what you're going to see is there's a band of tight gum tissue right around the tooth itself. And you can tell it's tight just by looking at it. You can see it doesn't move. When you go up above that, so up underneath your lip here, what you're going to see is you got all kinds of loose gum tissue. That's how you can move your lips and your tongue. And, that's how we can do all of these movements is because there's loose tissue. The key is, do you have enough of that tight tissue left above the tooth? If the answer is no, if you don't have any tight tissue, then you are really risking your tooth by not doing anything because now the tissue is I like to think of it like a belt on your pants and it's keeping the pants up, or down or wherever, it's keeping the pants where they belong. Once that belt is gone, the pants just fall. So if you have no tight tissue left around your tooth, what's going on is that everything in your mouth is getting up underneath there. It's eroding the bone underneath. It's spreading into the bloodstream. So you need to do something surgical, unfortunately, to fix that tissue if there's no tight band anymore. But here's the key component. You need to figure out, why did you lose it to begin with? Because if you just do a gum graft, but you don't address why the recession was there to start with, then you're going to recede the graft. I just did a video on this yesterday, talked about it's kind of like, your house is on fire, but all you're going to do is turn off the fire alarm. Well, no, the fire alarm, so gum recession is a fire alarm. It's saying something's wrong here. Let's figure that out first. Then if need be, we can actually do a graft, but may not need to be. If you can stop whatever's causing the recession, and if it gets and there's still a band there, there's still a tight band there, as long as it stops, you may not need to ever do anything surgically. So that's the key. Figure out what's causing it. What are some potential causes? Well, everybody blames brushing your tooth too hard, but I don't buy it because a lot of times it'll be like right here and right here. And it's like, okay, why did you just pick those two teeth to brush too hard? Well, I didn't. Exactly. So most likely it's because of the way those two teeth are touching each other. So it's bite related frequently. A lot of times it's related to if you're squeezing and clenching your teeth because you're not getting enough air. So if you have extra bumps of bone down here and gum recession on the outside, this is an airway problem. This is a breathing and sleeping problem. You need to have a cone beam CT scan of what's going on. Are xylitol mints a safe amount to consume daily? Biodentists recommended them. Okay, so there was just a new article about xylitol that has everybody up in a huff right now. It's all about amount. So are xylitol mints okay to do daily? 1 mint, yes. If you're going to eat that entire package every single day, no. It's about the amount. And they did this testing in the research article. I have the research article. I've looked through it. They did it with large amounts of xylitol. They're starting to use xylitol in a lot of diet foods. So they'll have sweetened drinks with it. They'll have sweetened like baked goods, those kinds of things with xylitol. They have too much xylitol in them. That's what they were testing for. I do not recommend diet foods with xylitol. Okay. I would recommend it in a tooth care product because it does neutralize bacteria in the mouth. It's excellent at that, actually helping to prevent cavities. So from a mint, a tooth powder, a mouthwash, those are all fine because you're not consuming them. The mint, yes, but the tooth powder, mouthwash, you're not consuming them. You're not just guzzling it like you do a drink. Mints, I would just be cautious. How many are you doing? How many are you doing? Make sure you're being cautious of that. But I think one a day, you're probably fine. One, maybe two a day, you're fine. Is it difficult to book an appointment with you? Well, it depends on the day you're asking. Yes. However, I have made it much easier to get into our practice. So we have now, let me think, 1, 2, 3, 4, 5 of our doctors that have been trained personally by me, literally shadowed me, walked around, and we have doctor case presentation meetings where we get together and we talk through different scenarios and we talk through specific patients and their concerns and their needs, and we help each other diagnose, and we learn a lot from each other this way. So we now have a lot more availability to come and become a patient in our practice because we have 5 doctors that are doing it instead of just me. What is an alternative to a root canal? So the key is the tooth already dead? If the tooth is already dead, the alternative to the root canal is removing and replacing the tooth with a ceramic dental implant. If the tooth is not dead, the alternative is removing the tooth decay all the way down to the deepest layer, but not exposing the nerve, using ozone over that to kill the bacteria, and then filling over it and keeping the tooth alive. So that's the key question. Is the tooth still alive or not? Oil suggestion for oil pulling. For oil pulling, honestly, the best oil is the one that you can stand. I use coconut oil because it just doesn't really have much of a taste. Some people use sesame oil. In old Ayurvedic tradition, they would use sesame oil. I don't love it. And honestly, sesame oil is pretty pricey. So I like coconut oil. I'll do about half a tablespoon to a tablespoon. It depends on the size of your mouth. Honestly, I can only do about half a tablespoon, but I really like coconut oil. I got a crown and have sensitivity 1 month out. Could it be the type of crown they used? The dentist made it on site. So sensitivity on a crown is going to be one of 3 things, basically. One, it could be the way it's hitting. So if you're hitting too hard on it, so what I want you to do is swallow and just very gently let your teeth come together and see, is that the tooth you're touching first? If that tooth is the one that you're touching first, then most likely that crown is just too tall. And it's every time you bang on it, it makes it a little bit more sensitive. So that's possibility number 1. You need to go back to the dentist. You need to have him check and say, I feel this one, it's a little too tall. Number 2 is the bond itself. So the bonding material itself sometimes will create a little bit of a bubble underneath the glue and the crown. And what happens is every time you bite, it'll get just a little bit of pressure. So if this is biting sensitive, it may be the bonding itself. And give it some time. We tell people about 3 months, give it some time. If it's still doing that, you may have to have that crown redone. The third one is just some sensitivity around the edge of it, around the edge that's just a little more exposed. If it's hot and cold sensitivity, that kind of thing, what you need to do is you need to hit this with a tooth powder. You're going to brush with it, but you're going to also use some powder, make a paste, and rub it right along where it's sensitive. The mouthwash is actually also phenomenal for decreasing sensitivity. You just need to get more minerals in, and the sensitivity should go away. So those are 3 options. Does placing an implant return the body's meridians to normal function? Great question. We have to kind of talk about what a meridian is first, right? So what a meridian is it is basically the electrical connection that your body, the wiring in the body system. And each tooth is on one of those wires. So if you have lost a tooth, you've in essence shorted that wire a little bit. There's not as much conduction along that line. If you place an implant back into that meridian, the problem is that we don't want anything conductive there. If you have something conductive, so a metal implant, it will actually create more of a short in the line. A zirconia or ceramic implant is non-conductive, and it will stimulate the bone there. Does it restart the meridian? I don't know. But the good news is that every meridian has 2 teeth typically that are associated with it. So let's say I lost this tooth. Actually, I am missing this tooth. I'm missing that tooth. The tooth behind it is on the same meridian. Now, what if you've lost 2 teeth in a row? Put an implant there because it's going to give you the greatest chance to restart that meridian. And why does it matter? Why does it even matter to have that gone? Well, it just shorts the circuit. So in essence, this tooth is my bladder, kidney, gallbladder. Those areas are right here. So if I'm having issues there, it may be because I've got a short circuit here and I need some more stimulation in that area. So it does matter. It affects the other systems in the body. I've had 3 implants done on the front that are 24 forward. So that means right in here. Do they have to be completely redone or is there another solution? My teeth are rubbing on my lower lip. It's a great question. It's one I think we'd have to look at a CT scan to determine, why are they rubbing on your lower lip? Is the crown on the implant in the wrong position? That may be all that needs to be done. So I think that's the starting point with a CT scan to see what's really happening down there. Is baking soda and peroxide good? Well, the question is good for what? Baking soda and peroxide will actually create a reaction, kind of a bubbling reaction. If you've ever seen that, it can be quite caustic, meaning it can be a little bit, it'll almost burn your gums. So I don't like to use peroxide very often in the mouth because it can really damage gums if used too frequently. There are some other things that will clean just as well without the damaging potential. Colloidal silver is one of those. So I really don't use peroxide. It's interesting because I used to use peroxide a lot underneath like temporary crowns and things. I'd take a temporary crown off and then I would clean the whole area with peroxide and it would literally bleach the gum. Like the whole gum would just be white after. And I'm thinking, I think this is kind of dangerous. So I don't use a lot of peroxide. I use colloidal silver instead. Is it okay to keep the silver filling in your mouth if they're not bothering you and there's no decay? It's a loaded question. So that silver filling is 50% mercury. So if it's not bothering you and there's no decay, that means that dentally and structurally it's fine. However, there is scores of research showing that literally 24/7, that filling is releasing mercury into your system. So the question is, are you okay with that? Are you okay with that? Is your body okay with that? My body was so not okay with that. I got very sick from mercury. So in my case, I say, no, I want that mercury filling out, but you get to decide. It's up to you. Do you care that mercury is being released into your body 24/7? You may not. Some people are like, I'm totally fine. Great. Leave it there. If that's an issue for you, if you have other health concerns and wonder if mercury could be a contributor, what are symptoms of mercury issues? A lot of numbness, a lot of brain fog, energy issues, and stomach problems. I had all three and I wanted it gone. So you just have to gauge where you're at. Could you please tell me the name of the appliance used for degenerative TMJ issues? I need to find someone locally that might use them. So what it's called is a neuromuscular appliance. Neuromuscular appliance, and I'm trying to remember the company. I don't remember. Message Kathleen, if you're on here, we will get that information. But yeah, look up neuromuscular appliance and you will find that. If you call our office, we can tell you there's an online directory you can check. Thoughts on xylitol nasal spray? Okay, so again, we're back to the xylitol question, and the key is just consistency and frequency. How much are you doing it? Are you doing it often? And how much xylitol is in that spray? I don't know the answer, so look on your xylitol bottle and compare. The test, they were using about 30 grams of xylitol a day. So you need to compare and see how much xylitol is in that spray. 30 grams, way too much. Let's see how much you're getting through that spray. If I rinse my mouth with salt and baking soda, can I brush my teeth right away, or do I still have to wait 30 minutes? I have weak enamel and I don't want to brush anything off. So if you rinse your mouth with salt and baking soda, first of all, both of those are alkaline, slightly alkaline. So they're not going to be a problem with brushing right after. They're slightly alkaline. I would again then say, why are you using that? I'm guessing just to alkalize it, but you shouldn't have a problem with that. How do you open or widen the airway? So this is a little bit of a misnomer here. You don't open or widen the airway, you get things out of it. So for example, let's think about a hoarder's house, right? The hallways, when that person moved into that house, the hallways were set. They were as big as they're going to be, and they were plenty big enough, right? Those are set by code. They were plenty big enough. The hallway was great. But then when they started stacking used pizza boxes in the hallway or whatever it is, all of a sudden the hallway is not nearly as big as it used to be. The hallway wasn't the problem. It was all the other stuff shoved in the hallway that was the problem. Same thing happens with your own airway or the tube that you breathe through. The tube is that way when you're born. Now, there are some structural things that can be problematic, meaning if your lower jaw is far back and crowding into there, if your tongue is tied down and falling back into there, all these things. But the tube itself isn't the problem. It's all of those things back into the airway. So it's the tongue, it's the tissue, it's everything that's crowding it, it's the pizza boxes, basically. It's all the stuff that's been shoved back into that airway, into that hallway. So there's not enough air to pass anymore. So the key is getting all of that out of there. Sometimes we need to make more space up here in the mouth so the tongue can come up and forward and out of the airway. How do we do that? We have a couple of appliances, removable appliances that you wear that help to expand the mouth. Sometimes we need to retrain the tongue. We might have to clip a tongue tie underneath the tongue so the tongue can come up and forward. We'd retrain it so it knows how to do that. Sometimes we need to widen the roof of the mouth so it widens the floor of the nose so that there's more room for air to come through the nose. So most of it is structural. Again, it's the hallway. The hallway is usually fine. It's what's pushing its way back into the hallway that we need to clear out so there's enough room for air. What about clove paste? So again, the question is, what about clove paste for what? Is it helpful for gums? Clove is antimicrobial. It's also a little bit analgesic, meaning it numbs. So it kills bugs and it numbs a little bit. So if you have a gum abscess, if you have a sore gum, if you have something like that, it's going to be great to treat that area. It's usually something we use temporarily, just for a short term because something hurts. And then we fix the reason for the hurt, and then you don't need to use the clove paste anymore. So it's not something that we use on a long-term basis, because there's other things that are a lot easier to use and that don't numb your mouth and other than clove paste. What can you do for deep pockets in the gum? So the key to deep pockets is figuring out, why is the deep pocket there, right? What is the deep pocket from? And could be a couple of things. Number one, it could be because there's a big piece of tartar that's stuck way down underneath that gum, and your gum just says, I hate this. Please get this thing off of here. I'm going to keep shrinking back until you get it gone. There may be tartar up top as well with lots of bugs living in it. So that's what the dentist has to do, is we have to get in there and we have to clean out whatever gunk's going on there. Another thing is, you might actually just be having bone loss everywhere in your body due to poor mineral absorption. You're just not getting enough minerals. So do the baking soda test, figure out what's going on with your gut, and then supplement vitamin D and K and minerals. You've got to add more, otherwise your body will consume them and eat your teeth and your bones in order to do that. So those are two things that we will always address. Let's kill the bugs, and let's give your body what it needs to actually heal and grow bone. What is the new Smile Active Gel for? Mixing with a toothpaste, is it okay? Oh, how is the new Smile Active Gel? Actually, I don't know much about Smile Active Gel, so I'm going to have to do some research into that one. We just haven't had to use it. Honestly, when we use the hydroxyapatite tooth powder and mouthwash, we don't need anything else. That's just what we use. And everybody, we have hundreds of stories of people saying, I had 3 cavities when I was at the dentist. I went back 6 months later and they were all gone. Where'd they go? They just got remineralized. There's just minerals back in them, so there's no cavity there anymore. It's crazy. All right, I got to jump over here to these questions. How do you feel about implants? Are they safe, and are there alternatives? So implants are fabulous. I love implants. The ones that we recommend are ceramic. So ceramic or zirconia, those are the 2 names that we use, and they are very safe. The titanium implants are the ones that typically have some other systemic issues. So we stay away from those. We use ceramic. Alternatives to that would be something removable. So like a retainer with a tooth on it, or a bridge. Bridges have other issues though. I typically steer clear of them, because a lot of times what happens is about 10 years down the road, you're going to lose another tooth that's holding the bridge because it's just too much stress on the tooth. So typically we'll steer you toward an implant or a removable something, or nothing. You don't have to replace a missing tooth either. Most people want to, but you don't have to. I love your products, especially the deodorant. With the tooth powder, I'm glad you like the deodorant. With the tooth powder, I've had to back off from using it, even though I love the way my teeth feel. As soon as the powder touches my teeth, they get painful. Using the sensitive powder, what's happening? I want to keep using it, but I can't handle the pain. Super fascinating. So I'm going to have you use it in a different way. What you're going to do is you're just going to use the mouthwash for a little while. So use the mouthwash and see what that does. A lot of times you're going to need to build up almost a protective layer, because what sounds like you have is wide open tubes from the outside of the tooth all the way to the nerve. That's why there's so much connection, or so much, talking back and forth. So you need to create a barrier between that nerve. So you're going to have to do that first. I would use the mouthwash first, twice a day for a month, and then go back to the tooth powder and use it sparingly, like once a day. And just see if you can ease your way back into it, because that sensitivity is showing us you really need to get hydroxyapatite into your teeth. Start with the mouthwash first. Can anxiety and gut issues contribute to making someone cavity prone? Interesting. So gut issues are related to anxiety. Gut issues are related to cavities. So absolutely. So it's not the anxiety piece that's related to cavities. It's the gut piece. If you're not absorbing minerals properly, what's going to happen is your body is going to take them from your teeth and lead to more decay. So you've got to get on top of the gut problems. That is your number one. Gut issues, and then the cavities stop, and anxiety also lessens immensely. What are the alternatives to a CPAP for snoring? Oh, this is a huge one and needs much longer than my 30-second talk I'll give you right now. Go check out, we have a whole bunch of stuff on YouTube and things. The idea is you've got to figure out what's going on. It's usually too little room. Like I talked about that hallway and the pizza boxes, it's too little room for air to pass. So you need a CT scan to figure out what's actually happening, a cone beam CT scan, dental specific, to find out what's actually happening. Is it because your jaw's too small? Is it because the jaw's too far back? Is it because the tongue's too far back? What's actually going on? CPAP doesn't fix anything, right? A CPAP just forces air down your nose, down your throat. It doesn't fix a thing. Your problem is still there. So what we want to do is we want to fix the problem. We want to make the mouth bigger so there's plenty of room for everything to fit, including the air. I have issues with mouth breathing at night and bruxism. Would you recommend a cone beam CT scan? Absolutely, because bruxism is basically grinding your teeth. Mouth breathing at night means you're not getting enough air through your nose. You need a cone beam CT scan, what structurally is happening, and then that is going to help. Do we have a list of preferred dentists? We do. Please get on the Living Well with Dr. Michelle's site. Go under Dentist Finder, and we have one, and we're trying to grow it and build it as much as we can. We're talking, believe me. I'm speaking at a dental convention this weekend. I've got another dental podcast in a couple of weeks. Like, I'm trying to get the word out as much as I can and get dentists on the directory. Is your toothpaste oily? Not at all. There's no oil in it at all. In fact, so not oily at all. So I think you're going to love it. But the tooth powder for sure isn't oily, but no, there's no oil in the toothpaste either. Is a night guard for teeth grinding helpful? Not necessarily, because it doesn't address, yes and no. That's not true. Yes and no. Yes, in that it will protect teeth from the grinding, so you're not going to grind them away more. But no, in that it doesn't address the problem. So you got to figure out, why are you grinding? Usually it's an airway issue. Start with a sleep study. I use Biotine every night for dry mouth from my meds. It has xylitol in it. Is that okay to use? So if you're just using it like as a rinse or a gel on there, I think once a night you're okay. But yeah, we talked a lot about dry mouth. Exactly. I would also add my mouthwash, because it has marshmallow root, which actually stimulates saliva naturally. And it's also very protective with the hydroxyapatite. So try that. Also has xylitol, but you're rinsing and spitting. You're not drinking. You know what I mean? You're not consuming. You're just rinsing and spitting. Can I find a doctor like you in Canada? We're working on it. Working on it. I had a root canal in the upper canine and I had pain on my eye, same side of the tooth, and headache. What's your advice? Cone beam CT scan. That's the first thing you need to do. Cone beam CT scan. Ordered a few days ago. Good. Everybody's excited about the products. Excellent. I think we're about done here. Let me see if there's I have a spot on my back bottom molar tooth that keeps getting bigger. I just got your mineral toothpaste. Is there spot treatment for those areas in addition to the mineral powder? Yes. So what you're going to do is you're going to brush with the tooth powder, and then you're going to get some extra of the tooth powder, and you're going to make a paste, and you're going to just put it right on that spot. So it's the same product. You're just going to use it in a little different way. Put it right on that spot. Go to bed. That's the last thing I want. I don't want you to wash it off. I'm in Utah. I had a really bad experience. I'm sorry to hear this. Spent a lot. Not happy with my teeth. I need to come see you guys. Yes, you do. Come on over. We'd love to see you. We already saw, how do I vet the list of dentists we recommend on your website? Great question. So a lot of them have actually taken courses and training from me. So if they've taken training courses from me, then that is already going to vet them, because I know that they've been trained the way I want. Now, every single recommendation you're going to have to take with a little bit of a grain of salt, because do I know they're doing everything that they were trained? No. And there's no way I'm going to be able to confirm that. There's no way I can. I can't go into every single dental practice and watch what they're doing. But it's as good as we can get right now. So that's number one. Second is we look at the training they've taken. And if the training is comparable, similar to what we do, then we know they've at least been trained properly. But again, I'm not going to their practice and verifying that what they're doing is exactly what they say. So you still need to ask the questions. You still need to ask the questions. All right. I think that that's about all I'm going to be able to do today. Such great questions. I will be back here. I cannot be on Thursday. That's what we did on Tuesday this week. I'm anyway, speaking at a conference this weekend, but we'll be back next week, next Thursday. Thank you all. Such great questions. Love it so much. Keep them coming.